Hello, my name is Christina Kapothanasis. Welcome to Traditional Chinese Medicine. Thank you for joining us today. We are going to be discussing a condition called vasculitis. I am a licensed acupuncturist here in the state of Hawaii, and I am board certified under the National Certification Commission for Oriental Medicine and Acupuncture. I also serve as the Executive Director of the Hawaii Oriental Medicine and Acupuncture Association. Today we're going to be talking about vasculitis. What is vasculitis? Vasculitis is a condition in which different blood vessels in the body are inflamed. Vasculitis can affect several different systems or only one system at a time. Some systems most likely affected are the skin. So people with skin ulcers, mostly located on the lower legs, but the ulcers can also be seen on the abdomen or the arms, also on the face or the neck near the carotid artery or the temple here. We can also see old ulcers healing and darker sores. They may be itchy, they may be painful. You may be able to palpate them, which is touch them and feel lumps, feel hard patches on the skin. This is a very hard to heal condition. Currently, Western medicine mostly uses steroids to get the inflammation under control. Vasculitis can also affect different systems. Sometimes it can present in the pulmonary vasculitis. So this is the lungs, some kind of constant sinusitis or upper and lower respiratory tract infections. You can also see evidence of vasculitis in the heart. Sometimes it starts in the aorta, which is a large blood vessel leading out of the heart, and it can affect the branches. In these patients, you will also see different kinds of palpitation symptoms, feeling that you can feel the heartbeat or fluttering. The vasculitis may also affect the kidneys. Glomerulonephritis is a condition of inflammation of the blood vessels in the kidneys. And it can also affect the peripheral, which means the central nervous system located at the extremities, or the central nervous system located in the core of the body. So, as well as the gastrointestinal tract, so your digestive system. Some patients may experience cramping or digestive discomfort, diarrhea, and there are several subdivisions of vasculitis. So each of these syndromes will affect they are all classified to affect different systems of the body, some overlapping. And as I said, Western medicine now, their best way to deal with this is steroids, which can leave horrible side effects, long-lasting side effects, and doctors don't like to use steroids if they don't have to. Chinese traditional medicine is a wonderful alternative, can be complementary to your Western medical treatment. And today we're going to talk a little bit about our view and how we look at vasculitis, how it's diagnosed, and how we treat it with herbs and acupuncture. In Chinese traditional medicine, we have something called syndrome differentiation. Just like in Western medicine, where they subclassify vasculitis into several different syndromes, we have our own subclassifications. Not quite using the same diagnostic methods. When we diagnose patients, we look at the tongue, we take the pulse, and we ask the patient's history. And we'll look at the skin and look at the exterior signs and symptoms that they're exhibiting. But when we classify, we are going to come up with different symptom names, syndrome names. The first subclassification of vasculitis is Yong Deficiency creating heat in the body. So this is the idea of not having enough fluids and blood in the body and creating heat. Just think of being dehydrated, not having enough water, and feeling warm and flush. So when a person comes in with a very red, cherry red tongue and a fast, thin pulse, even the tongue coating may have no coating whatsoever, and this kind of patient, we're going to think, we're going to ask questions associated more with the heat symptoms. So we will ask questions pertaining to heat. Are they really thirsty? Do they have constipation? Sometimes they may be able to go to the bathroom but have pebbles for stools, little hard rocks. These patients may have insomnia because heat usually disturbs the mind. These patients may also feel hot in their limbs. They may feel flush. They may have night sweats, sweating while they're sleeping. They may have headaches, and possibly the vision may be blurry. So blurry vision would maybe indicate some kind of heat in the body. They may have painful joints because if there's not enough fluid to moisturize the joints, the synovial fluid in the joints, if it's too low, then moving the joints may be painful for these patients. And they may also hear a low ringing sound in the ears called tinnitus, a buzz kind of sound. So this would be our first classification, Yong deficiency with excess, with the deficient heat, too much heat in the body. The second category we classify is qi deficiency resulting in stagnation. This idea, you can think of a river that has water flowing through it. If there's not enough force behind the water, then the water will flow very slowly. In the blood vessels, we need enough qi, which is energy, to be able to push the blood and circulate the blood properly. Vasculitis is always a problem of blood circulation, and we need to keep the blood flowing so that the blood can take oxygen and nutrients to the tissues and properly nourish them so that we don't have any inflammation. People with qi deficiency, deficiency of energy, you can think of being low on fuel. They may be tired. They may fatigue easily during the day. They may also have headaches, but they may have some kind of sore joints. They may have insomnia, and they may have palpitations in the heart. These people may also suffer from loose stools if they don't have enough qi in their spleen. The pulse, when we take the pulse, it will be thin and it will be weak. When we press harder on the pulse, sometimes we don't get a pulse at all. Maybe the pulse, when we take it more superficially, we will feel the pulse, and as we press deeper and deeper into the bone, the pulse disappears. This is a weak pulse, and qi deficiency patients will often appear with this kind of pulse. A stagnant pulse we will feel is a little bit choppy. In Chinese they say 色脉. So it's a little bit rough and it's not flowing as smoothly because of the stagnation, which is sort of a poor circulation. You can think of it like poor circulation. The last two categories, we have kidney and spleen yang deficiency, and we have a damp heat in the body. Kidney and spleen yang deficiency is a lack of warming energy in the kidney and spleen to create proper qi and the qi which would move the blood through the system. If we have yang deficiency, that means the person is going to exhibit cold symptoms. We have qi deficiency being the first step. Your energy is weak, and when it is weakened to a point where it becomes yang deficiency or deficiency of warmth in the body, then that's one step more severe than qi deficiency, and we can see cold symptoms. So these people may feel cold, they may be sensitive to air conditioning, and the limbs, either their legs or their arms, wherever is affected, may feel particularly cold and sensitive to cold. If they have cold water running over their legs in the shower, it may feel stinging pain, sensitive to the cold. Since it's yang deficiency is a step further than qi deficiency, these patients will also feel fatigued or tired easily. When we involve the kidneys, kidney yang deficiency patients will usually exhibit some symptoms of lower back ache. They may have had x-rays and gone to all kinds of practitioners to help with their lower back pain, but nothing shows up. This could be simply a kidney Yang deficiency symptom. Kidney and spleen Yang deficiency, if there's not enough warmth in the kidneys to heat the spleen and create positive spleen qi, then the digestion may be weak and they may have loose stools. These loose stools will usually be brown in color, indicating cold, versus yellow, which would be indicating heat. So a person with very little appetite, poor appetite, and loose stools may be suffering from spleen qi or spleen Yang deficiency. Their tongue will look completely different from the other tongue, from the yin deficiency, the heat tongue, because it's cold. If we look at a cold tongue, we're going to see it's quite pale. Versus the cherry red tongue, we would like to be right in the middle. Normal tongue is pink, and if it's quite pale, possibly having a little purple tinge, because when there's cold in the body, it's like the river freezing over in winter. The top portion of ice is frozen solid and doesn't move well. So this is another way to create poor circulation in the body. We have the heat can burn off the fluids so that the fluids, there aren't enough to move. The qi is weak, there's not enough force to push the fluids, and then the cold can also create this kind of stagnation where the blood cannot move and circulate properly. So for their pulse, for their tongue, we might see a little bit of purple, pale tongue, purple indicating stagnation, and it may have a thin white coating, white indicating cold as well. It also may be slightly enlarged. Sometimes these patients feel that the tongue is filling up their whole mouth cavity. Their pulse might be thin, it might be deep, and it might be a little bit slower. The last category is damp heat in the body. Dampness is another pathogen that will create stagnation in the body. Dampness is a sticky condition. Damp heat together will entrap the qi and the blood so that it also can't flow very well. These patients may suffer from digestive problems, bloating, nausea, loose stools, but this time the stools may be yellow and have a foul odor. Their ulcers, if they have ulcers and sores on the skin, may have a pus that comes out of them, and the pus may also have a foul odor to it. These patients may have a bitter taste in the mouth. Their tongue will have a yellow sticky coating, which is telling us sticky coating dampness and yellow heat. And their pulse may be fast from the heat, and we say slippery. It's a quality of how it flows quite quickly and a little bit forceful through the pulse. When we diagnose the patients and we come up with their proper differentiation syndrome, then we can come up with a treatment plan. And we use acupuncture and or herbal medicine to treat these kinds of patients, along with diet and lifestyle recommendations. Today I brought a few herbs to show you some of the common herbs that we use to treat vasculitis. So if you'll come with me this way. These are some of the herbs that we use to treat vasculitis, among other conditions. It all depends on what symptoms you present with. The herbs here in the front, this is taoren, this is honghua. You probably know this one as saffron. These herbs are very strong for circulating the blood, promoting circulation. Taoren is neutral, honghua is a little bit warm. So when we are talking about cold and heat in the body, we're going to need to balance, bring the patient back into balance. If they're exhibiting more cold symptoms, then we'll need to use warmer herbs. If they're exhibiting more warm symptoms, then we'll use cooler herbs or neutral herbs. It's the effect that it has on the body, not the actual, to the touch. It's of course not hot or cold. Guizhi, this is a cinnamon, skinny cinnamon twig, and this herb is wonderful because it goes directly into the heart. So patients that are suffering from vasculitis accompanied by heart symptoms directly, it helps to open up the channels of energy in the heart, and it helps to warm the heart qi, so yang deficient patients would benefit well from this. Back here we have danshan. Danshan is a cold herb. It goes into the heart and the liver. When we're working in terms of diagnostics and theory for Chinese medicine, heart and liver are going to control the blood, so we're going to put a lot of emphasis on the heart and the liver. Danshan is cold. It has a nice quality that it cools the blood. It also helps circulate the blood, and it is also calming. So for patients who are also suffering from insomnia, this would be an excellent choice for them. In the middle here we have mudanpi. Mudanpi is an herb that specifically is classified as cooling the blood. When you drink a cup of mint tea, that minty, cooling, refreshing feeling that you have, that's sort of what you can think of when you think of a cooling herb. This herb is extremely cold. It not only cools the blood, it also circulates the blood, and it goes into the heart and liver, the affinities with the organs that we need to focus on for blood problems. Over here we have ji xue ten. This is a warm herb, but it is especially good because it not only circulates the blood, but it also builds the blood. So we would choose from more than just these 6 that you see here, but we would tailor formulas to each patient's specific needs. The person with the Yong Deficiency needs cooler herbs like these and tiandong, maidong, etc. The person with the Yang Deficiency may need guizhi, or in extreme cases, foods. So it's a very hot herb. And then damp heat, we would use herbs to dry out the dampness and cool the heat. And for the qi deficiency, we could use herbs to boost the qi, like huang qi or taizhisan. We put the herbs together between 10 to 15 herbs. You can take them by boiling the whole roots as you see here, or in a powder form which you stir in water and drink. Both are very effective. In addition to the herbs, we can also use acupuncture, and I've invited a guest here today to be our model. This is fellow acupuncturist Nathan Zhen. He is also a licensed acupuncturist here in the state of Hawaii and board certified under the National Certification Commission for Acupuncture and Oriental Medicine. He serves as a director on the board for the Hawaii Oriental Medicine and Acupuncture Association. And he is from Taiwan. So welcome, Nathan. Thank you for joining us today. He's going to lie down, and we are going to do some points on the back today. So we will just lift up your shirt. And the points that we will be focusing on are, again, cooling the blood and circulating the blood. We are going to pretend like Nathan has the Yong Deficiency heat syndrome of vasculitis. First of all, we will just swab with alcohol to disinfect. All the needles that we use are sterile, disposable, as in one-time use. But for further prevention of infection, we will swab with alcohol on the places where we will be doing the acupuncture today. And I will explain the points as we go along. We're going to come down to the 3rd vertebrae and do Shenju. Here are our needles. These are about 1.5 inches. We don't go in all the way. We just wait until the patient feels a little tingling sensation. We use a guiding tube. Insert the needle into the tube. And the first point that we'll be doing today is called Ge Shu diaphragm point. This point is located at the 7th thoracic vertebrae. We insert at an angle to avoid hurting the lungs. And this point is good for cooling the blood, boosting the qi, boosting the blood, and circulating the blood. This is called the blood hui xue, xue de xue hui, hui xue. So this point is especially good for any problems of the blood. Again, we insert obliquely. The next point we will do is called Shenzu. This point has similar qualities of releasing heat from the body, cooling the blood, and circulating the blood. We are going at an angle up because the vertebrae, when they come together, they have a protrusion on the back, so we're coming up between these two protrusions like this. So we have Shenzu, we have Geshu. In the lower limbs, we will do Weizhong. Weizhong is the bladder Sha He Xue, and this point is especially good for detoxifying heat and toxins from the body. It also is excellent for circulating the blood. This point is additionally good for anybody who has lower back pain. This is often needled in cases of lower back pain, as well as Ceng San. When you find the insertion point of the muscle, there's an indentation down here. You come in the middle. Ceng San, good for cooling blood and opening the channels. So in Chinese medicine, we have meridians that flow. Inside the meridians are energy, and when they get blocked, for many of the reasons we discussed earlier, from the heat, from the dampness, from the Qi deficiency or the Yang deficiency, the cold, then those meridians need to be opened again, and this is excellent for that. The last point we'll do one on your side to show you. It's in the crook of the elbow. If we bend our elbow and make a fist, we can feel the two tendons that rise up here in the middle. It's on the inside, right in here. It's called a Qu Zi. It's on the pericardium meridian, pericardium and heart, pericardium being the muscle around the heart. And this point is excellent for clearing the heart heat. This is very specific to the heart, so patients with heart conditions, heart vasculitis, cardiac vasculitis, this would be especially good for those patients. It also has a calming property. These are the points that I've chosen to demonstrate for you today. We usually leave the needles in for about 20 minutes, 20 to 30 minutes, while your herbal formula is prepared. I'm going to remove the needles quickly today because I would like to show you one other treatment method that we have. Sometimes there's a drop of blood, sometimes there's no blood at all. But if there's blood, it's usually just a drop under the cotton ball. And the needles are disposed of in a sharps container, never to be used again. Okay, well, if we can have our model sit up for us. Then we will show one last treatment, which is called ear seeds. Ear seeds are a small piece of medical tape attached to a seed, and we place these on different points in the ear. So if you think of hand and feet reflexology with different parts of the hand relating to different organs of the body, the ear is similar in that respect. All of our body parts and organs have corresponding points in the ear. There are about 100 points in your ear. If we are working with a heat patient, a vasculitis condition that has yin deficient heat, we will be putting the points on our chin. The tip of the ear is good for taking out heat. If we come down slightly, we have, oh, these are sticky. We have Shenmen. Shenmen is good for clearing heat, it's good for controlling pain, and it's good for calming, so it will help with sleep, as well as our gin on the top here. They both help with heat and sleep. If we come on the inside of the ear, we will pick his heart organ, though if the patient has a spleen, kidney deficiency, we would focus on different organs. These ear seeds will stay on for several days. You can take a shower with them, and they will fall off during the shower or your daily activities, no problem. The heart is here in the center of the ear, so we would put these points for somebody with heat, and you can squeeze, pinch from front to back like this, the different points to stimulate those areas and help with your condition. We usually pick 3 to 4 seeds on each ear, and they usually last between 3 to 5 days. So that concludes our show on vasculitis today. We thank you so much for joining us, and I thank Mr. Zheng for being our very generous model for today. Those are some of the points that we would choose to treat vasculitis, some of the herbs, and the way that we would diagnose in terms of traditional Chinese medicine. If you have any questions for me or Mr. Zhen, you can always contact us at the number on the bottom of the screen, which will be displayed again at the end of the show, or email us. Thank you so much, and until next time, mahalo.